You're listening to Boomers Today with your host, Frank Sampson.
Well, welcome to Boomers Today. I'm your host, Frank Sampson. Of course, each week we bring you important and useful information on issues facing baby boomers, their parents, and other loved ones. And I want to thank everybody so much for all their support. Our listeners are growing really organically each and every day, and I want to thank all of you for doing that. You share our podcasts or our radio show with friends and family, and that's why our listeners are growing. And if you're not aware, some of you may be listening to the podcast right now, either on your iPhone or Android phone. We have a free app called Boomers Today on those phones. You could also go on to Google Podcasts, Apple Podcasts, iHeartRadio, many other sites. Our podcasts is, and we're on various radio stations, different parts of the country as well. Certainly, you can go directly to our website at boomerstodayradio.com. And, we get so many listeners because we have so many wonderful guests. And we have another one joining us today. We have with us Kim Callinan. Kim, I should have asked you, did I pronounce your last name correctly?
You did. Thanks, Frank.
All right. So Kim is the president and CEO of Compassion and Choices, where she has had a leadership role in authorizing medical aid in dying into 5 new jurisdictions. She launched the Finish Strong initiative, which includes a book and suite of new tools to empower patients to take charge of the final chapter of their lives. Kim is frequently invited to speak at conferences, testify before state legislatures, conduct policy briefings, and serve on committees as an expert on end-of-life care options. Kim, it's an honor to have you on the show. I'm a fan on what you have accomplished and will accomplish. So thank you so much for joining us on Boomers Today.
Thanks so much for having me, Frank. I really appreciate the opportunity.
Yeah. So, I kind of gave a little introduction, but maybe you could give us a little more detail about Compassion and Choices and kind of what your goals are, and just share some information with us.
Absolutely. Compassion and Choices is the oldest, largest, and most active national nonprofit organization that is devoted exclusively to improving care and expanding options at life's end. And we really advance our work in several ways. We focus on changing laws, changing the health system, and then empowering individuals with the information and tools that they need to be able to live the final chapter of their life and die on their own terms.
Got it. So the living part is one part of it. The dying part is the other. Let's talk a little. Can we talk a little bit about the living part first? All right, and just some examples of the types of things that you do and help with and legislate for, etc.
Absolutely. So the living part is all connected to after the onset of some type of a serious illness, ensuring that people have the full breadth of information that they need to decide what kinds of treatment options they may want to take or not take. If you think about end of life, everybody, or the vast majority of people, desperately want to live. We want long, vibrant lives. The reality, though, is that with medicine, sometimes the medicine itself results in burdens to yourself that make the living part really, really painful and result in a tremendous amount of suffering. And so really when you hit that end point and you're considering whether or not you want a treatment or you don't want a treatment, what you want is full and complete information so that you can make an informed decision. And I'll use cancer as an example because that is perhaps the one where this happens the most. So there are many forms of cancer where you get chemotherapy and you will get that chemotherapy and it is effective and you go into remission and you live a long, vibrant life. But there are other forms of cancer and newer forms of chemotherapy or immunotherapy that we have very devastating impacts on the way on your body. And what you want to be sure is that you're asking the right questions so that you can make the right decision for yourself. There was an amazing study that was done that showed that doctors and patients have different definitions of what treatable means. When a doctor uses the word treatable, they simply mean that there is something that I can do to help, or not even to help, but there's a treatment that I can apply for you. There's some medical something that I can do. But they're not necessarily suggesting that it means it's curable or that you will resume your previous function. And so it's really important that patients understand how to ask the right questions so they can make the best decision for themselves.
Great. So I know, we've talked about this in our show in the past with other guests, but we can't talk about it enough because I think people don't fully understand it. But maybe you could help us understand, in your own words, hospice care, palliative care, the difference, and I think there's a perception out there when somebody hears hospice that their days are numbered, and that's not necessarily true, is it?
Well, with hospice care, when a person is enrolled into hospice care, it does mean that they are at the very end, and that a doctor believes in reasonable medical judgments that they have 6 months or less to live. So you still could have a considerable amount of time. And you can go on hospice care and improve. It doesn't mean you absolutely will die in 6 months. You can go on hospice care, improve, and get re-enrolled into it. The benefit of hospice care is that you get full wraparound care. It means that they're addressing your psychosocial, they're addressing, the needs of caregivers and family members, and they're treating your pain and your symptoms. It does mean that you're foregoing aggressive treatments. So it means that you are at a point where you have decided that whatever treatments are available, or there may not be any treatments left that are available, that you're foregoing them and you're going to focus on the quality of the remaining days of your life. Right. It's different from palliative care. Palliative care is available to anybody who has a serious or a chronic illness, and that's about focusing on relieving the pain and the symptoms that you're having, not on curing the disease. And you usually get palliative care in conjunction with other treatments if it's before you're enrolled in hospice. If you're enrolled in hospice, you're getting palliative care as the kind of medical care you're getting to ensure that you're comfortable.
Got it. Okay, good. So let's talk about something, seems to be maybe a little more controversial, and that's kind of planning for the end. So what do you feel is important for people to be thinking about as far as planning for the end?
So I think there's really two primary reasons to plan for the end. One is for yourself, and the other is for your loved ones. So if you think about it from your own perspective, I unfortunately have been on the other end of far too many people who did not plan for the end. And it wasn't until they were much too far along in the process that they recognized that they were reducing the quality of their life in such a way that they could never get back, and it wasn't necessarily lengthening the time that they lived. So if it's at all important to you that you have some level of quality of life, or what that quality of life looks like, taking the time to plan for the end is important. It can reduce your suffering, and it can improve the quality of life and how you live your life. But you may say, you know what, that's not important to me. So if it's not important to you, the other thing to think about is the experience of your loved ones. And when you think about the very end, an advance directive are your written wishes about how you want to be treated and what's important to you when you can no longer speak for yourself. And putting a family member in the position, or a caregiver, or even a medical professional in the position where they're making decisions on your behalf, having no idea what's important to you and what your values are, is really difficult. So if you're not compelled to plan for yourself, then I would encourage you to think about the experience of somebody else making decisions on your behalf if you haven't had the right conversations with them.
Right. That's extremely important. So what are, I think the thing that is a little more controversial, and I'm sure you get very involved with, is people who wish to die. I mean, there's a lot of people that say, "Oh, okay, they're already 95 and they go, I'm done," but they still might be okay. But I'm talking about people who have a disease of some sort, and there's just probably no possibility of them their life going on much longer. They're certainly maybe could be very painful, etc. Talk about that a little bit, and what is going on with that type of an issue.
Sure. So let me just step back one second before I answer that question, which
Sure.
is that really important that people are planning and thinking about the end even before they're sick, even before they hit that moment that you're talking about, where you have a 6-month or less prognosis, and you know that death is gonna happen. I mean, the reality is that we are all terminal. Every one of us, we know that we will die. It is inevitable, but you don't know when that will happen. And you could be fortunate and live until you're 100 years old with, quality of life, or you could, drop dead tomorrow, or get into a car accident. So the important thing is not to wait until you are seriously ill to start thinking about this. It doesn't actually increase the likelihood that you're gonna die simply because you filled out papers and had conversations with people about what was important to you. So I would definitely encourage people to plan no matter what point you are in your life. To answer your question about when people know that they have a terminal diagnosis, really they should be having conversations with, first of all, thinking about what their values and priorities are and what's important to them, having conversations with their medical professionals about what available treatment options there are, and making decisions that are consistent with their values and priorities. And we do have a couple of tools on the website that are helpful, I think. The first is around our advanced care planning. We have a values and priorities sheet in our advanced care planning book that lets you really think about what's important to you. And if you're really at the very end of life, we've had people who have said, the most important thing to me is that I get to hold my grandson who's going to be born in a month. And so their instructions to the doctor are, please do whatever is possible so that I'm alive to be able to hold my grandson.
Right.
And, the medical treatment that you get will change depending on what's important to you. For example, there are some treatments that are radioactive, and it means that you can't be near other people. Well, that may not be the treatment that you want to choose if you only have 6 months left to live and you want to hold your new grandson. So those are important conversations to be having with doctors, and there are many excellent doctors, especially those that work in hospice, that are really prepared to help you through those decisions. And then in addition to that, in different states, you have different options. In every state, you have the option of hospice care, and that is covered through Medicare and Medicaid. So that is an option available to everybody, and it does provide full wraparound care. In 9 states and Washington, D.C., you also have the option of medical aid in dying, which is when a terminally ill person who is mentally capable is able to request and receive, if they meet all of the eligibility criteria from their doctor, a prescription that allows them to end their suffering. And a very small number of people will choose this as an option in the 9 states and DC that it's available.
So I do want to talk more about that. And I also want to give you the opportunity to share with our listeners how they could learn more about your organization, about so much what you're doing. But we are going to take a quick 30-second break here just to recognize our sponsor, and we'll come back and we'll talk about all that. How's that sound?
That sounds wonderful. Thanks, Frank.
Great. Want to just remind everybody that today's show is sponsored by Senior Care Authority, an elder care consulting organization that has a national network of professionally trained and experienced local advisors to assist families in determining the right path for your loved ones. They'll discuss various long-term care options, whether it's in-home care, assisted living, memory care, or if you just need an advocate to get some advice from. A local Senior Care Authority advisor can help you now. So for a free 30-minute consultation with an advisor in your area, contact Senior Care Authority at 888-809-1231, or you could go directly to the website at www.seniorcareauthority.com, and you could find a local advisor in your area. We're back with Kim Callinan, who's the president and CEO of Compassion and Choices. So just so we don't run out of time here, Kim, I'm going to ask you just to share with everybody whatever contact information you want to share so they know how to reach out to your organization.
Thanks, Frank. The best way to find us is to go to the website and go to compassionandchoices.org. And our website is chock full of information. The Plan Your Care section of our website in particular has a number of really good tools and resources. I would encourage people both to check out the End-of-Life Planning Guide, which will allow you to select your values and priorities. We have a tab that links off to state-specific advanced directive forms. That's really helpful. And then we have our Dementia Values and Priorities tool. And this is a brand new tool. I guess it's about a year old now. And it helps people really think about the kind of care that you would want at various different points within a dementia diagnosis, and such a critical and important tool to use so that your loved ones are really prepared to help ensure you get the exact care you want if you end up in the unfortunate position of getting dementia.
All right. So I do want to talk about dementia. I want to talk about other diseases as well on the subject matter you brought up just before our break. You mentioned there's 9 states. I don't know if you want to mention those states. I kind of just want to get a better feel for you. Do you expect more states to be doing, basically legally allowing people to die under certain circumstances? But why don't you talk a little bit more about that, if you can?
Absolutely. So the option is referred to as medical aid in dying, and it is available in 9 states and DC. Those states are Oregon, Washington, Montana, Vermont, California, Hawaii, Washington, DC, New Jersey, and Maine.
Okay. All right. And what, bottom line, do those states allow that others don't right now?
So you have to meet the eligibility criteria, which is you have to be terminally ill, mentally capable, and have a prognosis of 6 months or less to live. And you have to be able to self-ingest the medication. So do some type of an affirmative act that demonstrates that you are the person who wants this. So a third party cannot make the decision on your behalf. If you meet all of those eligibility criteria, which 2 doctors have to confirm, then you're able to request and obtain a prescription medication that allows you to end your suffering. A very small percentage of people will choose to use the option. So across all of the authorized states, 10 authorized states, you are only in the combined 50 years that the law has been in existence across these states, about 6,000 people have requested the prescription and around 4,500 have taken it. So we're talking about very small percentages who want the option, but the option itself really is critical because it establishes that the patient should be the decider in their end-of-life care. And after a law gets implemented in the state, what the data shows is that it opens up conversations for between doctors and patients. It improves enrollment into hospice care. It improves palliative care in a state. So it has an impact for far more people than those who choose the option.
So can we talk a little bit about dementia or various types of dementia and how does that fit into all of this? Because you said that somebody would have to be medically capable.
Yeah.
All right.
Yep.
People with various forms of dementia, Alzheimer's, there's Lewy body, there's some tough ones out there. And so how does that fit in, or does it, in what we're talking about?
So if you're talking specifically about the option of medical aid in dying, the only disease that a person has is dementia, they are not going to be eligible for medical aid in dying because they're not mentally capable within a 6-month prognosis. Some people who are in the early stages of dementia who have a different disease, like they've got cancer too, they would be eligible. So it's not that, but the combination of dementia in 6 months would mean that somebody would not be eligible for medical aid in dying.
Right.
However, there are options for people to plan for an end with dementia, and those are the dementia values and priorities tool that I talked about. Right now, with dementia, in most instances, the goal of care continues to be the extension of life throughout the time that a person has dementia. And it's really important that people understand that with dementia, people can live many good years often, where
right, exactly.
Not that a dementia diagnosis immediately means that your life is over and that there's nothing meaningful left. I mean, people can live many, many good years with a dementia diagnosis. However, for many people, you will hit a point at which you no longer have a life that feels meaningful to you. And the key is for people to be able to think about and articulate in advance, what is that point for me? And then for the goal of care to move from the extension of life to allowing a natural death to take place. And if you don't pre-plan, the likelihood is that that switch will never take place because our medical system is so focused on prolonging life. That is kind of remains the goal of care. So you have to do something to interrupt the normal course of treatment, and that pre-claiming your wishes in writing and having a strong healthcare proxy who will advocate for those wishes is really, really key in ensuring that happens. And you can cut years off of the length of time someone would live with dementia, because the reality is our medicine has gotten really good. We've got feeding tubes that get put in. The data shows that someone in the advanced stages of dementia is still getting aggressive treatments in the last 3 months of their life. So if you don't want that, at some point with a dementia diagnosis, you really do have to document your preferences so that the normal course of medicine gets interrupted.
Yeah, and working with a lot of families who have a loved one with dementia, sometimes that, quite often that disease affects the family members more than it does the person who has the disease.
Yeah, and that's exactly right. And the level of challenge that the disease, the burden of having to make decisions around care with a dementia patient is also really, really difficult. So people don't want to seem cruel, like they, don't want to give the penicillin to their mother. And so that's the other reason that documenting the preferences is so important, because if you would want to allow pneumonia as an example, which used to be called the old man's disease because it is can be a very peaceful way to die. If you'd like to allow the pneumonia to end your suffering, if you have a dementia diagnosis, it will be much easier for your loved one to carry out those wishes on your behalf if you've documented that.
Right. So, you did mention that Compassionate Choices works to change laws to improve how people die. Can you talk about that a little bit more? Just maybe some examples that you can give?
Sure. So on the state level, the primary laws that we are looking to advance are the medical aid in dying laws that we talked about earlier. And you'll see that about 24 states will put legislation forward annually. And we've had a lot of success within the last 5 years. So of the 9 states in Washington, D.C. that's authorized, 6 of those states were authorized in the past 5 years. And I can't remember if I mentioned Maine or not. If I left that one out, Maine is also authorized.
Right.
So medical aid in dying at the state level is a big focus. And we focus so much on that because it helps to demonstrate that the patient is the decider in their care. And it really changes the way the health system starts to think about the patient's role in their care. So that's the reason that that's so important. At the federal level, we actually are currently working with Senator Blumenthal from Connecticut on legislation to improve advanced care planning and to make it more portable. So right now, if you have an advanced directive done, there's a good likelihood that, it won't be sort of linked across all of the various hospitals that are in an area, and it's not portable from one state to another state. So there's a lot of challenges with our existing advanced care planning policies, and that legislation takes a look at those policies and put some resources behind helping to see what are the things that we can do in order to improve advanced care planning and make sure that they will become advanced directives will become more portable and more enforceable, and also that people will become aware of the importance of doing this is also a critical part. And then the third piece to the laws that we look at is ensuring that there is equity in end-of-life care. And there are several, unfortunately, groups or populations that are less likely to engage in advanced care planning, less likely to have documented their preferences, less likely to get pulled into hospice care, get adequate pain management at the end of life. And it tends to be African Americans and Latinos, as well as other vulnerable populations. And so we look at laws that will help to reduce the disparities in end-of-life care that exist and advance laws at the federal level in that regard.
Got it. So you mentioned resources, and I'm sure, I'm one, and I'm sure we have a lot of people listening that believe strongly in what you're doing. It all takes money. So where's your money coming from? And those people that are listening that would like to help, how do they go about doing that?
Thanks, Frank. That's a great question. Our money actually all comes from individual donors. We get 99% of our annual income comes from the generous contributions of donors, living and in wills through planned giving. You can go to our website under compassionandchoices.org, and there's a button up top that says donate date, and there's a little link to ways that you can give. So people give to us through straight out just contributions on our website. They also put us in their wills and leave us in their legacy plans. It's not uncommon for us to get a very large gift for somebody after they've died, and sometimes it's even people we had no interaction with during their lifetime. People give to us through IRAs, all sorts of ways. So you can go onto that tab and it provides information on how people give. But we are funded exclusively by generous individuals.
Kim Callinan, President of and CEO of Compassion and Choices. Check out the website, compassionandchoices.org. Kim, thank you so much for just everything you do. We really appreciate it. And thanks for joining us on Boomers Today. Thank you. And I want to thank everybody out there for joining us today. Please be safe. And we'll talk to everybody real soon.
You've been listening to Boomers Today with Frank Sampson. To learn more about today's show, visit boomerstodayradio.com and join us next time for another edition of Boomers Today.